I'm here with Dr. Jay Singer. Jay, everybody who has braces wants to get them off as soon as possible. And when they want to get them off, they want to have this perfect result forever. Let's talk about retention and what your definition of retention is and what options people have today.
Well, Kenny, as you know, when you remove the braces, the teeth are not totally firm, and there's osteoid, which is not totally mature bone, and the teeth are prone to shifting a little bit. So everybody needs some form of retention. And normally we use removable retainers, but in some patients we use fixed retainers, which is a wire that's glued behind the teeth.
Not visible.
Totally invisible, and that stabilizes the teeth. I tend to use that selectively. I gauge each individual case on the merits. If it was a patient who had very severe rotations, but also exhibits good hygiene and does not have a breakage history, then I generally go with a fixed retention.
Now, will the retention or stabilization be for a limited time, or do you tell your patients it could be forever?
Well, the trend in orthodontics has been towards indefinite retention, which means really long-term. And you can wean the patient down on the retention depending upon how stable they are. Generally, I start with full-time retainers for 2 months, then I go with half-time or home-time period for another 4 months, and then after 6 months, then I'll just go with sleep time every night.
Right.
And then wean them down cautiously, depending upon their stability.
Before we get any further, I want people to know how to find you. So tell us where you're located, your phone number, website, and all that good stuff.
Well, I got a great location. I'm right off the Sawgrass Expressway on University Drive in the Coral Springs Professional Campus. First building in on the right,
Gorgeous,
off University
gorgeous
Drive.
Office.
And the phone number is 954-75-SMILE. And the website is
What is it?
www.singersmiles.com.
Okay, good. You and I do a lot of work together in both the adults and the children, and it makes your job as the orthodontist a little bit easier when there's not too much gum in the way.
Absolutely.
And it makes your job more stable when there's enough gum in place to protect it. And we have a beautiful synergy. I know I have to tell everybody, I had braces when I was a child, and when I was an adult just a few years ago, when I became an adult a few years ago, I noticed that my teeth were shifting, and at that time I said to you, can you do Invisalign? And we tried Invisalign, and it didn't quite do what we wanted. And then I said, okay, put on the brackets, and in a very short time it was all done, just like you spoke about, right?
Yeah, that's right. Sometimes those removable appliances will get you 99%.
Yeah, and I wanted it to be perfect.
Yeah.
And that's how it has to be for us. My staff loves going to your office. In fact, they saw your office and said, Dr. Levine, you got to redecorate your office because Dr. Singer has this magnificent office. And that's when we began our renovation here. And I know that the patients that I refer to you are very happy, both the adults and the children. And I got to thank you for taking care of them. In our office, I know orthodontists do a lot of complimentary look at appointments, exam appointments. It's not your records appointment. For our patients who do complimentary exams, consults, radiographs, what we would consider, I guess you would consider full records, and we feel that if patients are able to come in and meet us in my office in Tamarack, then they're more likely to stay with us. So if we take down that financial barrier to learning, it's fine. We've been in our office February 17th will be 38 years in the same office. So that's a pretty good record.
I'd say you have some pretty good experience behind that.
That's right. Quick mention about the patients visiting their dentist during orthodontic care.
Well, we encourage that. That's critical, that they maintain their recall appointments or recare appointments with their dentist. So I like generally 3 months for the adults and 4 to 6 months on the children.
Right, so they get to see their dentist. If there's any problem with decay or any problem with minor gum problems, they can take care of them. If they have some more significant gum problems, they come to see somebody like me, right?
That's right, that's right.
Okay, well that works out great. Again, it's a joy to work with you. You take care of me. You took care of me very well. You take care of our shared patients extremely well, and I love your enthusiasm. I love your innovation, and it makes our job much easier. Jay, it's been a pleasure having you on the show tonight.
Well, Kenny, I want to thank you again for inviting me, and I want to ditto everything you said. You are marvelous with our patients, and you really facilitate my treatment in so many different ways. So thank you again.
Well, it's a wonderful synergy we have. This is Dr. Kenneth Levine with Health Talk. We'll see you real soon. Thank you.
Smiling is infectious. Yes, it's true.